So I want to welcome you all to the second part of the mentorship. And what we're going to discuss this time around are really all the other tests outside of how to identify mold exposure that will be helpful and important to understand how to manage these kids and also what other data points you want to think about and get to really make sure you're able to help these children. To start, I want to highlight something because I think this is an important point that really needs to be reinforced. This collective combination of mycotoxins and endotoxins can wreak havoc in so many different systems that if you miss it and you don't understand the fundamentals, you could be chasing after all kinds of things and not understand why these kids aren't getting better. And why I haven't talked about, how do you manage adrenal glands? How do you manage mitochondrial abnormalities? How do you address oxidative stress? Is if this core piece isn't dialed in, everything you will do at all of these other levels will completely flop. And I'll give you an example, just the first thing with the mitochondrial abnormalities. For many years, I was decent at addressing mitochondrial issues through selective supplementations or cocktails like Spectrum Needs, and I had about 30% of the kids that were getting way better, and I looked really smart. The kids were either more interactive, more talkative, focusing better, but then there were a whole lot of kids that just were not getting better, and I couldn't understand why. These kids, some of them had gastrointestinal issues. I had kids that had weird adrenal abnormalities, and I've actually made my own tincture to address adrenal issues. And I would give it to these kids, and some of them would get better, and some of them would just completely fall apart. And why I'm stressing this is in our world of functional integrative medicine, so many people are so wrapped up in pushing complexity, and you need to do this, and you need to address the HPA axis, and you need to address the mitochondrial issues, and blah, blah, blah. When you've got these toxins at play, because they profoundly disrupt the mitochondria, profoundly disrupt fatty acid oxidation, and because these processes are important for steroidogenesis, which ultimately influences the production of cortisol, the sex hormones. It influences gastrointestinal functioning because you get mitochondrial function, you get massive oxidative stress, and you could throw as much glutathione or antioxidants into this mix, and guess what? It won't help. These mycotoxins are xenoestrogens. So on one hand, you've got disruption of the endocrine production of hormones, but then on the other hand, you've got this abnormal stimulation of the estrogen receptors. And I've have a whole bunch of kids that have gone into early puberty, and it's because of these hormones. And these are things that we're going to talk about in much greater detail. But I wanted to just highlight this right now because it's so easy to say, well, God, this approach is so simplistic, it's not going to work. And you can then go marching on to focus on a whole bunch of other things based on what you have learned. Except when you really stand back and look at what these toxins do and look at not just how they disrupt the gastrointestinal tract, not just how they disrupt the nervous system, but really how they influence, for instance, cerebral folate deficiency. Mycotoxins cause cerebral folate deficiency. If you have enough disruption in the gastrointestinal tract, you can get antibodies to folate receptors, which can then cause cerebral folate deficiency. You get disruption in the lipid membranes, on and on and on and on. So not that this is a deep dive in all of this, but I felt really inclined to just include this to help you see how important these fundamental steps are. And if you miss the fundamental steps of identifying the mold exposure, understand how to control it, and we'll get into it later on, how to identify things in terms of exposure into the environment. You're going to be swimming up creek, except that creek is the Colorado River, and you're going to be paddling as hard as you can and not understanding why these kids are not getting better. What I see in the world of functional and integrative medicine is this constant push to become more complex, do more complex testing, and with that, more cost. And it's not to say that genetic testing and some of these really fantastic tools that have come about are not useful at all. The only thing that I believe is they should never be your first step. And if you start focusing on the minutia and you start focusing on the genetics, except you've missed the things that are disrupting the total system, have you done your patient any good? And what as I listen to other lecturers, podcasts, what I keep seeing is this domain of how beautiful all these tests are and how whatever tests, save their patient's life and how, this $2,000 or $1,500 test gave the answer that they needed to help that patient. But I want you to ask yourself, in the big scheme of things, how often are these tests really necessary? And given what I shared over here, if you can address the root cause of all of this in one fell swoop, how often will you need to have that $1,500 test to help your patient get better? And again, I'm not saying that these tests are never useful. I'm not saying don't think about them. I'm not saying they cannot help. They can definitely help. They are useful. They should definitely be considered. But try to get into the mindset of, I've got this elephant in the room that I've got to take care of. I first need to take care of this elephant. And then once I take care of this elephant, then, hi, Lev. What? Oh, thanks. Thanks for sharing that, Lev. Can you go play with Oliver? Thank you. That was my little guy. But start getting into this mindset of, what do I need to take care of first? What is the first thing that I need to address to then allow all other systems to come together? And then perhaps at that stage, then I will be able to focus on everything else as needed. And there's a chance that it won't even be needed. We're going to get rid of this. So I want to present a case that I think really highlights this perfectly. Lucas is a 7-year-old that I recently saw who presented with autism, a host of learning disabilities, and just anxiety, OCD, the typical patterns that you see. When he was 2 to 3 years old, he already had speech delay, but was interacting appropriately, at least from a social standpoint, which is what we typically see in these kids, right? At the age of 3, family moved to Florida, and basically he crashed. Significant irritability, tantrums, eczema went out of control, drop in eye contact, and he started developing motor tics. By 4 to 5 years of age, he had developed asthma. And what the family reports now at the age of 7 is that he is just a faucet. So if he doesn't get Allegra and Zysol, so one in the morning, one at night, literally he is so congested that he can't sleep, he can't breathe. He still has poor social skills, missing social cues. He scripts rather than has any dialogue, is totally disconnected, and forget about teaching him anything because nothing seems to stick. He had his adenoids taken out, and then a year again, needed to have his adenoids taken out again. And while he doesn't have obstructive sleep apnea, he snores, he's congested. By the time he was 6, he had 14 cavities, 6 caps, a bunch of food sensitivities, dark circles, and sleep disruption. Now, they had lived in multiple homes, and when I asked them about, well, how's your current home? Oh, we tested it. We don't have any mold. Mom has some pretty bad issues. Dad has such severe congestion that for the one time he stopped his antihistamines, he got an ear infection. 40-year-old getting an ear infection, a little weird, right? Younger sibling has eczema and speech delays, and some of the other siblings also have some challenges. At the age of 3, they started doing some workups, and the primary at that time found the eosinophils to be elevated, but didn't do a whole lot more of a workup. They did food allergy and environmental allergies and found, a whole bunch of things. So you can see he was 2 to 3 plus on walnuts, cashews, pistachios, hazelnuts, almonds. This is a type of yeast. And then you can see a host of other things there. And again, they're like, oh, he's got allergies and he's got some eosinophils. At the age of 6, they saw another provider who started doing genetic testing and found that he was, heterozygous for MTHFR and a host of other things. They found that he had various kinds of issues with an inflammatory response. And ultimately, they tried various things based on these genetic studies to try to help, which actually didn't do a whole lot. They ran some organic acid tests, didn't look terrible. Nothing really stood out there. And then they ran some blood work, which at the time also you can see, TSH, BUN, liver enzymes, WBC, everything looked fine. They ran a urinary mycotoxin, which showed some ochratoxin, but at the time they're like, is this mold? Is it not? We don't know. They ran stool testing. They found some H. pylori. And they also found a little bit of blastocystis hominis, but all in all, things, again, did not look terrible. They ran heavy metal testing and nutrient testing through the hair. And, they found some things. Ultimately, the provider at the time did not feel really inclined to do anything with it. They ran some additional testing when he was 7 and tried some B12, various other things, and nothing really seemed to help. They even ran this neural zoomer, which is a way to look at the neuroinflammatory response. And you can see that he had some antibodies against the myelin sheath and a few other things of just cerebral inflammation. And it wasn't terrible. And, the provider at the time is like, I don't know what the heck is going on. One of the providers, before that, these were labs that I ran, which, again, didn't look terrible. ANA was fine. CBC was fine. He still had elevated eosinophils. LFTs were okay. He had a little bit of elevated cholesterol with a keto diet. But things did not look bad, minus this gliadin antibody being slightly elevated. One of the things that stood out with what one of the prior providers did do was they prescribed fluconazole along with a lot of sensory integration OT, and he momentarily got better, but probably within 2 or 3 months of the fluconazole, he slipped backwards again. And the family is like, we don't know what's going on. Why is he struggling the way he is? And this really brings us to, if you miss the elephant in the room, if you miss what is driving this child's symptoms and challenges, you'll be in exactly the same place where you will try all kinds of things. You may go after the genetic testing and try the genetics. They may or may not help. You can try anti-inflammatories. You can try a host of different things, and nothing will ultimately help that much. So what was the elephant in the room? This. The elephant in the room was the fact that the family did test for mold, but didn't do it appropriately, and they missed contamination. And you can see it. The reason why I brought up this case is I think it's a perfect reflection of how you can spend thousands of dollars. You can go after anything and everything, and what you will have are these marginal improvements that then slide backwards, and you can't understand why. And this is, in a case where the provider correctly thought, like, God, maybe this is yeast, maybe this is fungus. Let me try fluconazole. So they actually were thinking along the right lines. They were thinking about the right thing, even though the testing was off. What they missed was this. And the reason why I'm highlighting it is to have you stand back in these cases and say, God, this really looks like mold. Because in my experience, at least, there are not that many things that cause chronic congestion, chronic runny nose. There are not that many things that cause such a massive inflammatory response where a child needs to have their adenoids and tonsils taken out. Mind you, that was in the prior home, right? So when you see these things, when you hear these things, what I want you to start thinking is like, is this child living in ugly amounts of mold? Because if they are, and a level 5, you can argue is potentially, and again, we're not environmental specialists, we're not here to tell the family there is for sure mold, but as far as you're concerned, if you see a code 5 or you see a high level of contamination on an ERMI, and Hertzme's of 15 and above are usually indicative of contamination as well. If you see that, you have to set a realistic expectation like, hey, we're going to try to get your kid better. But if you have a lot of mold, there's only so much we can do. And in the case of this little guy, I started him on the anti-inflammatories. I actually had the family stop his antihistamines in the CBD, and he got marginally better, like 10%. He started becoming a little bit more engaged. He started having a little bit more interaction. But at the end of the day, the family's like, we didn't see a whole lot. And that was because they're living in mold. And again, I want to bring this up because when this exposure is taking place, it's like the entire house is burning down all at once. And you can try all kinds of fancy things. And trust me, like before taking on this mindset, I was doing all kinds of antioxidants and sulforaphane and curcumin and glutathione and just about any and every combination you can think of, and nothing was making a dent. And since I've pivoted and now said, well, God, if all of this is happening at the same time, maybe I should go after the thing that's causing all of this first. And in doing so, the kids are getting much better. So what about the genetic testing? I want to start there because I think because of certain market forces, more and more providers are being pushed into thinking genetics is the end all. Genetic testing and genetic focused treatments are fantastic. I think they can absolutely be helpful. And I'm sure you've either tried it or you know of other people who have tried it and have found it helpful. That is not the question. The question is, when do you do the genetic testing? And what things should you take care of first to allow those focused treatments to then really have a positive impact? And if you're trying to treat some of these pathways when you have missed mold toxicity, this is the best analogy that I can come up with. The oil flow is still pouring and the fire is still raging as a result of that. And you're trying to put out that fire, except it's not going to work. What about MTHFR? 10 to 12 years ago, I was obsessed with MTHFR and I thought it was the end all of everything. And what I came to realize was that it's not. First and foremost, if you look at the prevalence rates of just this one gene, and I'm giving this as an analogy to a lot of other things because there's a lot of people who have genetic anomalies and they don't fall apart. So it begs the question of what causes people to fall apart and how do we prioritize various findings? Because I get a whole bunch of patients who have had testing for MTHFR and, whoever it was that did the testing goes chasing after the folate, and half the time the kids get worse. Probably another 40% of the time, nothing really changes. And then 10% of the time there's improvement. First and foremost, it's really complex. So for those of you that are just checking MTHFR as a sole gene, you're missing the bigger picture. While it does influence a whole lot of neurochemicals, by itself, it's not the one thing And if you stand back and say, well, God, what are the more important things outside of the mycotoxins as we discussed? It's actually things like folate receptor antibodies. And we're going to touch on that towards the end of this presentation. So I'm sharing this because I want you to start thinking about how to prioritize these things. Chances are just about every single patient that you'll get who has various kinds of learning disabilities and challenges and behavioral issues has methylation errors. You push methylation first, you will end up causing a panic attack, anxiety, exacerbation, and I'm sure some of you have already seen that. And this is how I've come to see treating these things first, especially with B vitamins. It was probably about 8 or 10 years ago, on top of causing a mess in multiple children when I was on the bandwagon of treating these things first, I decided to put myself on mega doses of folate. And what I started realizing was after about a week or two that I was actually having, full-fledged anxiety, borderline panic attacks, and couldn't understand why. When you have issues related to inflammation, right? So if you go back and you think about what these mycotoxins in the microglia and so forth do, right? The astrocytes can trigger all kinds of neurochemical changes. You can get changes in quinolinic acid. You can get changes in glutamate. You can get changes in NMDA receptors. And this completely distorts the neurochemistry. And if you are here coming along, and if you look in this pathway, and this is something I'd like obsessively looked at, and I came along and said, well, God, no, I need to take care of this because if I get more serotonin and dopamine in this kid's brain, they're going to start feeling better and they're going to start being focused. Except I missed the fact that there was between the glutamate and possibly quinolinic acid and everything else that was causing this child's brain to be on fire, I was actually pouring gasoline on the fire. So don't obsess with these things first. Get really, really good at healing the gut. Get good at identifying the exposure and resolving the exposure. And focus on just the core things that I shared with you. And what you'll see is these kids will get better on their own. And what you'll have is about 60% of kids that just continue to get better and better, and their focus is better, and their language is better, and their engagement is better. And then you'll have another probably 30-40% that will calm down, they will stabilize, but then all of the other deficits will come to the surface. And that is where focusing on the genetics, focusing on the fats, focusing on all the other things to improve cognition will really pay off. What about gut permeability tests? So we've talked a lot about how gut inflammation and ultimately gut permeability and these lipopolysaccharides can become a huge problem for these kids. The problem, as I shared with you, is the subtle things that, at least that I am aware of, very few people in our community are talking about. So initially, I suspected that some of the immunodeficiencies that we see like this are just in the little kids. And the more kids that I've tested, the more I have found that these antibodies are ultimately suppressed. Why is that important? Well, if you're running a test like this that actually relies on immune reactivity against various gut tissue, including, these occludin-zonulin proteins that have to do with keeping the gut glued together, the lipopolysaccharides that ultimately can trigger inflammation, except the immune response is suppressed. And what, I went back and looked at some of my cases, and what I keep seeing over and over again is, oh my God, look, there's a suppressed immune response that is probably where the challenges of these kids are coming from. So what does this mean? What this means is if you're going to do this testing, don't hold your breath that it's going to show you the results that you're looking for. If anything, what could be helpful, so this is a test through precision precision point diagnostics, and then this is a test through KBMO. If anything, looking at how suppressed their gut immune response is the data points that you would want to get from these tests. A lot of people talk about zonulin as a way to assess gut permeability. I was really excited and gung-ho about checking zonulin in kids because of some of these shortcomings until I came across several studies like this that basically said that assessing zonulin through at least the commercially available ways is totally inaccurate. If anything, if it's elevated, it could be because you're getting a reaction to various other proteins. And ultimately, the drawing any conclusions essentially from zonulin, which is one of the proteins that has to do, and if you go back over here, it was actually part of precision point. Basically, that's not a way. So unfortunately, at this time, at least from what I have learned and what I know, there are no good ways to look at intestinal permeability in terms of any of these gut tests that are out there. What about conventional labs? And this is really what I want to put the big focus of this conversation around, because I think through conventional labs, there's so much valuable data you can get that will allow you to really figure out what to do to help these kids. And it starts with some of the things that I've shared with you in the past: a complete blood count with differential, a metabolic panel, a thyroid screening, ANA, which sadly is positive in about 40 to 50% of these kids. So ANA being essentially an antibody to self tissue. 40, 50% of these kids are in some degree of autoimmune terrain. Checking iron studies, I'd say at least 20%, if not more, 20% have pretty significant iron deficiency, 30 to 40% have some degree of iron deficiency. And then there's checking for zinc deficiency, which I see in at least 50% with 20 to 30% of the kids having pretty severe deficiency. As you've heard some of your colleagues, they've brought up the possibility of checking a serum zinc to copper ratio. I think that's another way to do it. I've just gotten to a place where I think an RBC zinc, which is an intracellular zinc, is an accurate way to check. Checking for cholesterol, checking for immunoglobulins, especially IgG. Some of these kids do have IgG deficiencies, which completely throws off their ability to mount an appropriate immune response. I also believe IgA subclasses are important. The kids that I see that really get hit hard, the kids who stay sick the longest and are the hardest to treat, are actually the kids who have IgA deficiencies. Check them for especially food allergies, because if a child has a food allergy and you miss that food allergy, that is just one additional trigger to their immune system that's going to keep them stuck. If you have a child who is presenting with aggression, irritability, high anxiety, the typical PANS and PANDAS kids, at least check a strep antibody with the ASO titer and DNase-B. Now, there are those out there that strongly encourage the culturing of these kids. So doing a perianal swab and culture, and then obviously throat culture. The challenge that I've run into is I've had many kids who have had this test, came up positive, were treated with antibiotics, and either got marginally better, some got better, but the second they came off the antibiotics, they regressed. And if you look in the literature, what you find is that about 30% of healthy controls, 30% of healthy kids are colonized with strep, but obviously they're not presenting with PANS and PANDAS. So this notion of if you find strep, go after it and treat it is something that I've questioned because of that very thing. I check all these kids for thyroid antibodies. Sadly, 10% are frank Hashimoto's. Most often they still have normal thyroid function, but they're kind of marching towards developing Hashimoto's, and then there are others that have mild elevations of these thyroid antibodies. Why is that important? I look at thyroiditis, basically thyroid autoimmunity, as one bellwether of how healthy the immune system is or not. Because the thyroid is one of the most exposed organs that we have, it's one of the first organs to be attacked when there's some kind of, autoimmune state. So as you look at these tests, what you find is there's so much information you can get just through doing this testing, where minus maybe doing some, serum antibodies against mold or mold toxins. And then if you want, some of the gut testing, there isn't a whole lot more information you may need right off the bat to see what's going on outside of Lyme testing. And that's one thing we're not going to touch on so much. Checking serum histamine or tryptase is helpful. When these children present with elevated serum histamine or elevated tryptase, those are the kids whose immune systems are so out of balance. They have such significant mast cell instability within their gut that those are the kids that typically do not respond well to the anti-inflammatories. And that's because their guts are out of balance, their microbial makeup of their guts are out of balance, or they're just living in huge amounts of mold. The Saccharomyces cerevisiae, IgG and IgA, are two antibodies that I've recently become a huge fan of. So over the last 6 to 9 months, I've started using them. So immunologically, from an antigenic crossover standpoint, Candida, yeast, various other yeast, and molds actually look very similar to one another to the immune system. Furthermore, because these antibodies start telling you the integrity of the gut, right? So if the gut is in a good shape, right? If there's good gut integrity, this immunological reactivity will not take place. When the gut is disrupted, when the immune system starts interacting with the microbes inappropriately, these antibodies start ticking up. So with typically an insurance covered test, what you're able to do is actually get some pretty decent data to assess how compromised or not the gastrointestinal tract is. MMP9 we're going to touch on later. And then I included vitamin D, but frankly, I've stopped testing it because I'm starting to find more and more insurances are no longer covering it. And because of that, I had patients that were getting stuck with a $200 to $300 bill just for the vitamin D. And you can imagine that was not a very happy thing. So I've stopped testing, and literally I just cover all the kids with vitamin D. And sometimes, depending on the severity of the child, I'll dose a little higher, but keeping it within a range that I shared with you before, to the point where you can't really cause toxicity related to the vitamin D. So what about the CDC? What can you find with just some of these basic things? So you can get a lot of information just through a CBC and then iron studies and RBC zinc. When you have a suppressed WBC, if you have low hemoglobin, all of that is telling you toxicity is at play. Both mycotoxins and endotoxins, but particularly mycotoxins, as found right here, can cause leukopenia or cytopenia, pancytopenia, specifically with the white blood cells. So I've had kids, and I shared this with you before, where their absolute neutrophil count was below 1,500. It causes disruption of iron absorption. So these kids will end up with iron deficiency and anemia. You can get zinc deficiency. And for me, when I see this, it's not just, oh, this kid has toxicity. It's telling me that the child's gastrointestinal tract has been pretty significantly compromised. Because if it wasn't compromised, if the child's gut integrity was whole, their ability to absorb these nutrients would actually be really good. So just by looking at these very basic labs, you can actually start deriving some, not solid, but decent conclusions of where the child's system is, how much compromise you have at hand, and how much work you need to have ahead to get this child doing better. This was another patient where you can see their absolute neutrophil count was quite low. And just to give you context, for those of you that didn't spend a whole lot of time on an onc ward, kids who are getting chemotherapy, like in their full induction, I mean, their absolute neutrophils count drops to below 500. But a lot of times, those kids that are on chemotherapy are hovering between 800 to 1,000. And an absolute neutrophil count of less than 800 is significant enough where if those kids get a fever, they're automatically hospitalized and put on IV antibiotics because their immune systems are so shot. This is not a child on chemotherapy. This is a child that was getting exposed to mold toxins, and you can see they're not that far off. And I will only just toss this out there as a speculation, but if this kind of immune suppression lasts long enough, what is that child's cancer risk? What is that child's risk of catching all kinds of illnesses because of this immune suppression? So you can see that, through these WBCs in neutrophils, you can get some information. The hemoglobin, if it's low, hemoglobin gets tanked out if there's some kind of malabsorption, typically from iron. I mean, folate deficiency can do it too. Last time I saw a anemia from folate deficiency was never, but iron deficiency could certainly play a part. The MCV can guide you. If MCV is really low, think of iron deficiency. If it's really high, think of folate deficiency. Platelets are an acute phase reactant. So if you've got elevation of the platelets, you've probably got oxidative stress with some inflammatory response. And even the eosinophils, as you saw in that child that I presented earlier, eosinophils can tell you like, hey, we've got some kind of allergenic trigger. And if you've got a kid with sensory issues and hyperactivity and distractibility, and the child just cannot focus or regulate for the life of them, and the eosinophils are 8 or 10%, something is irking that allergy mediated response. And if you can figure out what that is, whether it's parasites or an allergen or mold, and I put adrenal glands because sometimes the adrenal glands, when they're off, can exacerbate this. There's so much information you can get just through this basic blood work. And these are things that we don't talk about often enough, right? It's not sexy to talk about just the basic CBC. No one's going to get any kind of affiliate fee to talk about how you can use a CBC to understand what's going on with the kid. And we've got this push to let's order these very expensive tests rather than spending the time to learn how to derive some really valuable information just through a basic lab. Albumin can tell you the nutritional status of a child. If you've got a albumin that's borderline low or low, there's malabsorption. Bilirubin at times can be part of this hemoxygenase, and I've seen a whole bunch of kids. So mycotoxins, for reasons that are way beyond this conversation, can trigger this pathway. And I've had a whole bunch of kids that had elevated bilirubins for, you go back for years. You take care of their gut, you take care of the toxicity, and bilirubin just corrects itself. Liver enzymes, really, really valuable data. If the gut is not compromised, if that child is not highly toxic, you won't get elevations of those liver enzymes. But if you've got a picture like this, or even this, and technically you can see this was tagged as normal. These are kids that have toxicity. Now, this is not the kind of thing that you would send to a GI, but if you see the liver enzymes go above 200 to 300, that's where I would definitely talk to a gastroenterologist, because now you're getting into liver disease territory, and that's a whole different conversation. Food allergies, again, and I included this a histamine level here because this was a child, well, he was a 16-year-old with pretty significant autism. He was verbal, but totally disconnected, no eye contact. The poor guy had such severe sensory findings where the smell of food caused him to just get completely grossed out to the point where he'd have to leave the room. The sound of the family eating with the knives and forks hitting the plates also just so overwhelming to him. And he was one where, again, I tried every combination that I could think of, and it just wasn't budging things. Why? Because he had full-blown mast cell activation. Food allergies, the one pluses I typically don't respond to, but if you've got a child that has a 3 to 4 plus food allergy, those are things that you definitely want to take care of because they're triggering further mast cell activity. I'm going to skip over this. So what about stool testing? You need to know what it is that you're testing and be really clear about why you're doing the stool testing. As you already know, there is no stool test on the market, including Tiny Health, that accurately assesses the fungal makeup of the gut minus candida. So if you're looking for presence of mold in a stool test, you're just not going to be able to find it. 90+% of the time, you will have mold exposure. You probably have some degree of abnormality in candida. It's just not showing up in a stool test. Why? Because you're checking the distal colon, and chances are the imbalance in the candida is higher up in the gut. What is a stool test useful for? So, first and foremost, I think they do give you a decent picture of gut health. So, let's say you've got a child where doing any kind of blood testing is out of the picture. There's no way the family can test a kid because they're 3 years old and just the thought of sticking a needle in them is horrific. One alternative is to actually check the stool, because if you check the stool and you can see this beta glucuronidase was elevated, and bacterial imbalances and toxicity can trigger this. Secretory IgA, which is basically the release of these immunoglobulins in the gut, is another marker of gut inflammation. So if you're in a bind, sometimes this gut health markers are useful. What else could be potentially useful? The problem with these tests is, first and foremost, when you're using PCR technology, because of the sensitivity, you start picking up ghosts. So you'll see these cases where you'll see these C. diff toxins, and if you've got Clostridium difficile with toxin production, chances are that that would show up as like frank horrific diarrhea, abdominal cramping. So I've seen people jump and start treating these things, except especially when it comes to GI Map, which is this company that runs it. They're pretty notorious for picking up things that don't exist. H. pylori, which we'll touch on, is significant. I'm going to skip that. Genova Diagnostics has a decent stool test, and you'll see a similar pattern in how they're picking things up with the gut health over here, the various gut markers. I personally don't pay much attention to these symbiotic bacteria. Why? And you may be thinking, well, no, you need to pay attention to these because you need to rebalance the bacteria, right? Because when you rebalance the bacteria, that's how you fix the gut. Go back and watch some of the prior presentations and pay particular attention to what happens to the microbiome when gut inflammation is at play, when mold toxins are at play. So the reason why I don't pay attention to any of this is because if you're seeing abnormalities, these abnormalities are coming from somewhere else. And you can try all the probiotic combinations in the world, and they will not make much of a difference until you actually address the inflammatory response. What is helpful in these stool tests? So the one thing that I'm a really big fan of is stool testing for parasites. So we're going to go over here. The things that are very capable of triggering gut inflammation, specifically mast cell activity, are parasites, especially the worm. So if a kid has gone swimming in some kind of lake or river, they may have picked up a gnarly parasite in H. pylori. And I am now getting closer and closer to a place where I'm pretty much becoming convinced that if you find any parasite, you need to take care of that parasite because that just becomes one additional trigger for the mast cells. One company that I've really come to like is it's actually a guy in his basement or in his own lab that checks the stool. And you can see he does multiple different methodologies, and his pickup rate of parasites is amazing, probably better than any of the private labs. So depending on your patient, depending on what you're thinking, you may want to run this test. It's about $250, or look at running a test through Doctor's Data or Genova, which will give you additional data, including the gut health. So stool testing is definitely something that I think is worthwhile. And this was one case where, in this case, this little girl was having just full-blown body rashes, and they had flown to Mayo Clinic. She had seen every allergist and dermatologist the family could find, and no one could understand what the hell was going on. They checked her for parasites via an ovum parasite, and one thing you don't see on any of these slides are the conventional lab tests, and everything was fine. We ended up running a GI map, and it turns out she had a hookworm. She had a hookworm, and we treated the hookworm, and family saw stuff coming out of her bottom. And then within a week or two, her allergies and rash went away. So I just wanted to share this because of how relevant and important these parasites can be in triggering this allergy response. What about other tests? If you're able to draw blood, and if you have a child who has, pretty significant regressive autism, they have severe neuroinflammation, severe ADHD, depression, if you can, and the family can afford it, and this is a $350, $400 test, consider getting this FRAT test. The prevalence of these antibodies. So basically, folate receptor antibodies are, you've got these receptors in the blood-brain barrier, right, that ultimately transport folate into the cerebral spinal fluid, right? They transport it into the brain. If you have these antibodies, you're basically plugging up these transporters and plugging up their ability to transport folate, which then causes a massive deficiency of folate within the nervous system. If that happens, you get all kinds of weird cognitive changes as a result of that. One alternative is family says, you know what, we don't really have $400 to spend, or you've got a little kid, you have to prioritize how much blood you can draw, and you can't really afford to do much testing outside of maybe the mold antibodies in the basic labs. In some of these cases, again, not as an initial treatment, and some of my friends that, MedMaps and some of these autism communities, they go for the, big doses of leucovorin first. Those are the times that I see these kids flip out. Get the kids stable, get their gut stable. Once that has happened, that is where, if you either did the testing and they were positive, or you're like, shoot, this kid has all kinds of weird things, severe inattention, severe focus problems. They look depressed, they look tired, etc., or issues with expressive language, eye contact. That is when you may want to put these kids on big doses of folate, and Dr. Rosenthal has published a paper with dosing around all of that. And in that scenario, once you've got these things taken care of, you would see these kids just light up, and all of a sudden it's like their nervous systems comes to life. Why? Because now they have the folate to then produce all of the chemicals, which then allows cognition to kick into place. I want to share with you what I've become a huge fan of. So Dr. Shoemaker, now 15 or 20 years ago, came up with various biomarkers to look at basically tissue inflammation, right? This chronic inflammatory response syndrome, CIRS. One of the things that he discovered was this matrix metalloproteinase or peptidase 9 that is basically an enzyme that becomes activated when the tissue is disrupted. And you can see they get into a lot more detail than that. But if you think about it as if the tissue matrix, if the tissue itself is disrupted, it could happen at the gut, it can happen, in the periphery. That tissue disruption is then sufficient to activate this. And one of the things that I have seen is that this MMP9 is really great at giving you part of a picture of how messed up this child's tissue is. As you saw in the prior presentation, there was one case I had where literally the only biomarker I had was this elevated MMP9. And everything else looked absolutely fine. And I just kept staring at this. And then ultimately the mom did their home mold test and they had a whole bunch of mold, way more than I even expected. It's covered by insurance. It's easy to draw. And I'll touch on why this is important in a second. And overall, I feel the sensitivity in reflecting if there's significant tissue disruption is pretty good. Can you use this as a single agent to say, oh my God, this kid has been exposed to mold, I need to worry? Absolutely not. As one biomarker to help you understand how much disruption there is, I think it's pretty darn good. Before, I was, looking and exploring at all kinds of other things to better understand how to identify what's going on with these kids and how to help them. I started running some HLA haplotypes early on, but then I got to a point where I'm like, God, this is silly. Why would I need to know a child's genetic predisposition to getting sick if they've already gotten sick? And how would these HLA haplotypes help me understand what to do with them? They're already sick. In some world where you're asking, like, do I need to be worried about this child's future exposure to mold? I think as a predictive model, it could be helpful. But frankly, I've stopped running these because the child has already been sick. They were already exposed to mold. They already have mold-related illness. So what difference does it make? Complement 4 is part of the complement cascade. So basically, it's this inflammatory cascade that ultimately helps inform if a child is having this innate mediated response to water damaged buildings. And in theory, it's such a valuable marker because it can tell you the total degree of immune distortion that's there. I was so stoked about running this complement 4A until I started realizing how problematic it is. So it turns out that these complements need to be drawn in a very specific way. They have to be spun down immediately. Then they have to be put on ice. And I think it's actually dry ice, not just regular ice. And then they have to be processed, I think, within 45 minutes to an hour of being drawn. And if you're using a mobile phlebotomist, that just completely flies out the door. And I even sent some kids to the actual draw stations, hoping they wouldn't muck it up. And even then it got mucked up. So over the years, why I have gravitated towards MMP9 and not these other labs is simply because of either what information is it giving, or it takes an act of God to draw it. So while the information is technically very useful, the practicality of getting that information becomes an issue. TGF beta 1, I have many friends and colleagues that love this. So basically, it's a protein that causes cellular transformation and ultimately drives the production of these various immune cells. Early on, I was looking at this. What I came to realize was there was quite a bit of variability between the different labs and even within the same lab. And reference ranges kept changing, different values and or ways they were running it kept changing. So there was this constant moving target of using TGF beta 1. And over time, I've pretty much stopped using it altogether. And MMP9 is the only one. And this vascular endothelial growth factor for adults, I know many mold providers use this. I just haven't ever used it, so don't have much experience in touching on that. What about glyphosate testing? If you have a child who lives in parts of the country where there's farming, if the child lives near a golf course, absolutely 100% check for glyphosates, because if there is significant glyphosate exposure, glyphosate is like mycotoxin's ugly cousin. Glyphosates will cause some of the very same problems that mycotoxins can cause. And you may be chasing after mold, whereas in reality, it's actually glyphosate toxicity. And focusing on the glyphosate exposure, using glycine to control it, totally different conversation. And again, it's something that I think is very valuable. It's a urine test. It's not terribly expensive, but very, very important. What about other immune tests? So we touched on the gut permeability. Cyrex has various other tests that I think are potentially very useful. So they have this Array 3X that's kind of the mother of all gluten response or sensitivity tests. How often do I use this test? Almost never. And here's the reason why. If a child has a compromised gut, and how you would see that is they're inflamed, they're reactive, they may or may not have digestive issues. The most useful thing you can do is just try to reduce the gluten exposure as much as possible. Every now and then you get a family that's like, there's no way in hell we can reduce gluten, except the child is not getting better. And that is where you may want to run this test. I believe it's about $200, and all you're checking for is gluten. But you can see it's not just a IgG to wheat or IgG to gliadin, which is right there. It is ultimately a very expansive test that will help you better understand the child's total immune reactivity against gluten. These are other tests that Cyrex has. I was a huge fan of these tests until I came to realize that the degree of false positives and false negatives in the kids were really high. Because of probably immunological abnormalities, and God knows what's going on in the gut, I've had many kids that I ran this on. And for instance, you would see that, where is the mold? So aspergillus and some of these are part of this screen. I think it got cut off over here. But the tests were just not very reliable in the kids. I know Cyrex has a wonderful reputation in adults, but over time, I just got to a place where for the money, the amount of information that I was getting was not useful. The other challenge that we run into is this thing called polyreactivity. At times when I was getting a positive, the positive looked like this, where there were more things that the individual was reacting to than not, to the point where you say, well, my God, so what is this person not having an issue with? And it looks like basically they have to stop eating everything and at a total systemic level, everything is going to be falling apart. This notion of polyreactivity, which is basically when the gut is compromised sufficiently, you get such profound immune activation that the carryover antigenetically, if you want to say, to multiple different proteins is really, really high. So, on one hand, you can get false negatives, in which case the degree of reliability is low, or you can get false positives, in which case then you don't even know what the reaction is towards. And again, because of this and the fact that these are, $200 to $500 tests and they require blood, I've stopped using them for that part. What about food sensitivity testing via finger prick? Unfortunately, these tests are not very accurate. There are some families where if you got a piece of paper and that piece of paper had some number on it, and that number is then sufficient to convince a family to say, oh gosh, oh, this number is pretty high. Okay, fine. Now I'm going to eliminate the food. Outside of that scenario, I honestly don't run these tests. But for $90 to $100 and a finger prick, if the piece of paper and hopefully some numbers that are semi-reflective of what's going on is what the family needs to be motivated to change the kid's diet, then I think in a scenario like that, it's worthwhile. And again, easy to do, not very reliable. The last thing that I want to show you is water testing, especially for those families that live on well water, but also some families that live in various cities and they're trying to figure out, and they don't have a very good filter. So let's say they've got a regular Brita filter or they drink water out of the fridge. You can get them to just use a reverse osmosis system, except then you end up causing potentially lithium deficiency and other mineral deficiencies that you have to replace. I've also had some families where they were living on, maybe not a farm, but they were living on a property where they had well water. And not too far away, within, let's say, 10, 15 miles, there are farms. In those cases, actually doing some water testing is not a bad idea because even if you filter the water, you want to understand what that child has been exposed to because, again, you may not have huge amounts of mold, but when you test the water, all of a sudden it's like, holy Jesus, the amount of toxins that are in the water may have been where all the disruption came from. And then your focus and attention on how to repair that child's gut needs to shift away from some of the, mycotoxins and everything else to other things like the glyphosates and other pesticides. Hexchromium could ultimately disrupt the gut as well. So looking at various other things to then help repair the guts of these children. With that, I thank you guys for taking the time to partake in this presentation and discussion. And I thank you.